My parents always encouraged me to pursue a career that I felt fulfilled in, and this pretty much met all of my requirements. My name is Daniel Young. I'm an occupational therapist at the Glenrose Rehab Hospital. As an occupational therapist, what I would do is assess and I would treat for function. Occupational therapy refers to the jobs of living. Basically being able to take care of yourself, and then what do you need to be able to do that, or how can we change that task so that you can do it given your condition. The draw I had to rehab was basically just improving clients and their lives and also their independence. I started at the Glenrose 4 years ago, and I've been on the burn program for most of that time. So basically I work and rehab burn patients. The Glenrose is a place I've always wanted to work at, even as a student. Basically, it's one of the largest rehab facilities in North America, so it's 244 beds, and it's a freestanding rehab hospital, which is quite unique. Just the time that we have to work with patients and also just the resources that we have available just makes it an ideal place for a therapist to really impact and make a positive influence on patients' lives. We really try to push those boundaries to really maximize what they can do and how functional they can be and how much independence they can regain following their accident or their injury. I can be doing a driver safety assessment, do physical range of motion exercise programs, to the provision of rehab equipment. So we definitely fill a niche that a lot of people may not be aware of. Some burn injuries, we can see pretty good recovery within 2 years. However, some injuries can be a lifetime. So it's really, the journey can be varied depending on the nature and the severity of the injury. It's very difficult for me to put into words how amazing the human spirit is and how just simply resilient people can be when they're faced with, insurmountable obstacles. The biggest benefit of being part of the HSAA is having job stability. I find that having that stability allows me to focus on providing excellence in client care. Hands down, that's one of the best things about being a union member. The interdisciplinary team that I'm part of is just amazing in that, we really strive to really, again, provide the best patient care that we can.